Today we're going to talk about gender-based burnout issues. And this is from a physician perspective, and that's the perspective I know I can speak to most about. But many of the things that I'm going to talk about today are related to other professions as well. These are our learning objectives. We're going to define the issue, talk about factors that increase the risk of burnout, and some specific gender-related issues, as well as strategies to mitigate burnout. So first, let's talk about what burnout is. The term burnout was coined in the 1970s by a psychologist who was working in an addiction clinic, and it was further defined by Maslow in the 1980s, and when she developed the Maslow burnout inventory. And burnout is considered a syndrome with three different components: emotional exhaustion, depersonalization, and diminished efficacy. Burnout can occur in any profession. It was first described in social work and teaching, and then the Maslow went on to look at burnout in the healthcare professions, and then it was further examined or researched in pretty much all professions. However, the research shows that one of the highest rates of burnout occur in the healthcare profession, specifically both physicians and nurses. For physicians, burnout not only affects us as clinicians, but it affects our family and the patients that we take care of. We know that people who experience burnout can have difficulty communicating with their patients. The quality of care might suffer, and the patient satisfaction can decrease. So this is a really important issue for physicians. We also know that close to 50% of physicians suffer from at least one of the symptoms or signs of burnout. So it is very, very common. So what are the things that can lead to burnout? One of the biggest problems can be administrative burden. As we have become more attached to the EMR, physicians notice that they feel like they're always on, that they can access the EMR anywhere across the globe, and so this means that there's always access to patients and patient care. There's an increased workload, a push for productivity and to increase the number of RVUs that a physician produces. And all those things lead to a feeling of a lack of autonomy, a lack of control. Physicians feel like their life is really not their own, at least their professional life. This can be quite a burden for physicians, especially those who are in employed practice, which is a growing number of physicians. And finally, lack of organizational support. Again, the things that I've mentioned earlier, make physicians feel like that nobody cares, that they're in this by themselves. Some of the individual factors that increase your risk of burnout is age. We know that people who are younger are at increased risk for burnout, depression, and anxiety. Burnout can lead to depression and anxiety, but also if you have depression and anxiety, you are at increased risk for developing burnout. And neuroticism, which is just a tendency toward depression and anxiety or negative thinking, can lead to increased burnout. I put down here imposter syndrome, and there's been a lot in the literature about imposter syndrome recently. And this is the feeling that you haven't, that you're a fake, or you are not successful no matter how much you do and what you have achieved. One of the things that some people say is that that this imposter syndrome is really because of the things that I'm going to talk about next for women and people of color. So that perceived feeling that you're not quite good enough can actually be because of things that have happened to you in your career, and it can be because of the bias in discrimination that women and people of color experience to a higher degree than men, white men, in the workplace. Sexual harassment that can come from patients as well as of leadership and even your colleagues. Work-life integration is another issue that women face more likely than men. We know that people who have children under the age of 21 have an increased risk of burnout, and of those people with the children under the age of 21, women are the main caregivers for these children. And so they take on the burden of raising the children, which can lead to burnout. Again, the work expectations, and some of this has to do with the expectations of colleagues and of patients who expect women to be by nature more nurturing and maybe spend more time with their patients than men, and that can put an undue burden on women. And finally, the lack of parity in promotions, in salary, in access to leadership. All of these things affect women more than they do our male colleagues. So we know that from the literature that women are more likely to feel the emotional exhaustion aspect of burnout when compared to men who are more likely to suffer from depersonalization. Women have, in most of the studies, not all studies that look at physician burnout, actually differentiate between burnout in women versus burnout in men. But those that do tend to find an increased rates of burnout in women. And the question is if this is an independent factor or is it a multifactorial issue. We know that right now the female workforce tends to be younger, than the male workforce. And as I said earlier, younger people are at greater risk for burnout. So as the female physician workforce ages, does that mean that the differences in burnout rates will kind of equilibrate between men and women? We don't know yet, and that's an area for research. We also know, again, that all of the things that I talked about earlier are more likely to happen in women than they are in men. So that you can't really tease out those factors from gender when you're looking at differences in rates of burnout. And this is one study I looked at said that women who experience burnout are more at risk for increased substance use, particularly alcohol. And I found that interesting. They really couldn't say why in the article, but it was something, again, that needs further study. Looking at women in academic medicine, women, the percentage of women faculty has steadily increased since 2008, and that's probably because of the increased number of matriculating women medical students. So we would expect that to continue to rise. And in 2019, there were about 41% of women faculty compared to 59% male faculty. And the burnout rates for just as in the general physician workforce, the burnout rates for women faculty are higher than those of male faculty. But if you look at women in academia versus women in private practice, the burnout rates are not statistically different. So there's something going on with women, whether we are in academia or in private practice, that is leading to our burnout. And some of the factors for women in academia are very similar to the ones for women in private practice, and those include the workload issues, the work-life balance issues, and as well as the administrative burden. What we also noticed that, again, women physicians are in academia are really have a problem with, or we experience a lack of access to leadership. In 2019, about 18% of women, 18% of the deans of medical school were women, and about 19% were chairs of departments. And the chairs are basic science chairs as well as clinical chairs. And so women are in academia. We're increasing in our numbers, but we are not increasing in leadership positions. We are less likely to achieve promotion and tenure, even though we're 41% in the faculty in 2019, only about 26% of us were full professors. And that all of these things are compounded if you are a woman of color as well. some of the problems that women in academia face are lack of mentorship and sponsorship. There have been, across the nation, there have been programs and universities that have not intentionally developed mentorship programs for women in particular, but really for all of their faculty. And this is, and women have suffered most because of this. When we look at what has happened with COVID-19 and burnout, if you look at the 2022 Medscape burnout survey, there was an increase, a COVID bump for burnout. And this specifically affected the frontline specialties that took care of COVID patients, the emergency room doctors, as well as the ICU doctors. And the burnout rates reached over 50% for these two specialties. But there was also an increase in the burnout rates for OBGYN and pediatricians. And those people were really not providing day-to-day care for COVID patients. So what was happening there? Well, when they looked at the data, they found that 85% of the OBGYNs were female, and 73% of the pediatricians. So during COVID, the women physicians were more likely to be taking care of their children at home, perhaps homeschooling when the schools are shut down, and even perhaps taking care of their elderly parents as well. So this increase in burnout was not specifically related to the care of the COVID patient. So what can we do? As individuals, we can participate in self-care. That means, exercise, a healthy diet, mindfulness, meditation, all of the things that we know will help us to build resilience. We, as physicians, we can know our priorities, set our priorities and boundaries, and know when to say yes and when and how to say no. Advocate for ourselves if we have not, if we don't have specific programs for mentorship and sponsorship in our universities. Find role models and sponsors and mentors for ourselves. And finally, we can, if we find ourselves depressed or on the verge of burnout or in early burnout, get help. One of the papers that I read said that the depression and anxiety was about the same for physicians as it is for the general population. The difference is that, but that there was stigma and bias around seeking help, and physicians were reluctant to seek help because of their fear of the licensing boards. And so we need to get beyond that. But make no mistake, burnout is not an individual failing. It is a failing at the organizational level. So you can do all the right things as as an individual, and if you do not have a supportive organization, then you can still suffer from burnout. And some of the things that the leadership of the organization can do is to level the playing field for women, and that means salary parity. That means making sure that women and physicians of color are being promoted. That means working to eliminate gender discrimination and harassment in the workplace, and in general, making the academic medical center a supportive work environment for all people. Thank you for the opportunity to speak with you.